The latest now on the coronavirus emergency. As we've been saying, more than 750 cases now here in the U.S., more than 20 deaths. And to get more on this now, we want to welcome the Surgeon General of the United States, Dr. Jerome Adams. Thank you for coming. We should probably show everybody the proper greeting these days.
I can almost reach.
There you go. Almost. Good morning, George.
Let's give everybody a sense of the scale of the outbreak to expect here in the United States. I've seen some experts estimate up to 100 million Americans could eventually be infected by this virus. That's going to put a tremendous strain on hospitals. Should Americans be prepared for an outbreak of this scale?
Well, Americans should absolutely be prepared, but that doesn't mean that they should be afraid. We've been here before, H1N1, SARS, MERS. We know how to handle this. And really what we're trying to communicate to people now is how they can prepare. I tell communities three things. Number one, know your risk. We know older people are at much higher risk for complications. Younger people tend to be protected from the complications of coronavirus. Number two, know your circumstances. Are you going to be in a crowded situation? Are you planning travel? And number three, know the steps that you can take to prepare. And I encourage people to go to coronavirus.gov to learn about how they can prepare, but simple things like social distancing. I don't shake hands anymore. We just did an elbow bump. Not touching your face, washing your hands frequently, and washing them for 20 seconds with soap and water. There are things that we can do to prepare and not panic.
That's everything that individuals should be doing. I guess one of the big questions now is what should communities be doing? We've seen the severe lockdown in Italy, basically the whole country on lockdown right now. More and more universities here are closing down, going to remote learning. What kind of community measures should be taken at this point?
Well, initially we had a containment posture, and that's outward facing. That's saying we want to keep cases outside of our communities, and that works when you know where the cases are coming from. Originally, over 95% of the cases were coming from China. Now, most of the cases are actually coming from Europe, South Korea, Iran, and we're looking at mitigation. And mitigation means within your community, how do you lower the impact of the virus and prevent it from spreading within those communities? And things like school closures, things like pulling down large social gatherings, things like telework policies. Those are all steps that folks should be thinking about in case they have an outbreak in their communities. And we know there are clusters in Seattle and Florida, in New York City. Not every community has an outbreak going on right now, but people should know that this is going to likely get worse before it gets better.
You're saying it's in the hands of the communities, but what are the national guidelines on what should be canceled?
Well, again, go to coronavirus.gov. We are putting out guidelines on that website. There will be advice today for all communities, but then there'll be specific advice for those communities who are seeing clusters.
One of the biggest issues we face now is a big lag in testing. The best estimate I've seen is that fewer than 5,000 people have been tested here in the United States. At this point in South Korea, there had been more than 100,000 tests. The UK has already had 25,000 tests. Why are we so far behind, and what should we be expecting as this testing scales up?
Well, it's important to understand CDC stood up a test for the coronavirus in a record amount of time, less than a week. There were problems scaling up the test. And when we looked at the test that was going on in other parts of the world, they weren't being held to the same quality standards that people in America expect and that the FDA regulations require. Here's the most important thing, though. The American people don't really care about the total number of tests so much as they care about whether or not they can get a test. We have over 1 million tests that have gone out earlier this week. We expect 4 million by the end of the week. And we want to get to a place where every American can rapidly get tested if their doctor says they should get tested and can get the results back.
How long is that going to take?
Well, we expect that that's the case now. Over 72 state public health labs are now putting out the test. And when people push for a number, it's important to know those labs don't have to report back to us. So that's why it's hard for us to say how many overall tests have been done. We can only say how many the CDC has been done. 4 million by the end of the week. We have talked to state labs. I've been to Connecticut. I've been to Florida. I've been all over the country. And right now, no state public health lab is telling me that they can't get the test and that they're having trouble meeting capacity.
This is all happening, as you know, in an election year. There have been calls for the candidates, all of the candidates, simply to suspend campaigning, no more big rallies. Is that wise?
Well, one of the things we tell folks is, again, know your risk. If we know seniors with chronic medical conditions are at increased risk for complications from coronavirus. And then know your circumstances. If you are in one of those high-risk groups, you should think carefully about the steps you can take to keep yourself safe. And if you're one of these candidates out there, make sure you're washing your hands frequently. Make sure you're using hand sanitizer. Consider an elbow bump or even just a chest tap We don't want folks to put themselves at any undue risk. And if they don't, then we can prevent the spread of coronavirus. We can tamp down the fears. We will get through this.
We reported on this earlier in the program. The coronavirus seems to be creeping in a little bit on the White House. You've had Mark Meadows, and now the chief of staff, self-quarantining himself as well, other members of Congress. What kind of risk is the president facing right now?
Well, the president's got the best doctors in the world, and they are going to talk to him about his risk and about the circumstances that he's putting himself around. And I have every confidence that they're going to give him the advice to keep him safe and to keep the people around him safe.
Surgeon General, thanks for your time this morning.
Thank you. Go to coronavirus.gov.
We will remember that.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.